It's day 3 of 3 things your doctor may not have told you about MCAS. Today, 3 hints your irritable bowel might actually be mast cell activation. Here's number 1. It seems like everyone has gut problems these days, and different practitioners have different tests they use to diagnose. But what if you've gone and done all the labs and they all come back negative? Full blood work, organic acids, GI map, hydrogen breath test, everything negative or inconclusive. Okay, remember that the gut is lined with mucous membrane. And also remember that mucous membrane is chock full of mast cells. Also remember that mast cells are responsible in part or in whole for the symptoms that you feel because of the part they play in the inflammatory cascade and an inflammatory response. So if you have bacterial overload, the mast cells are going to tell you. If you have fungal overload, the mast cells are going to complain. And lastly, remember that in mast cell dysfunction, the mast cells react for little or no reason. So if you've got all the symptoms, but you don't have any of the labs, start thinking mast cell. Number 2, the diets don't work. Most people would agree that diet is the first line of defense when dealing with irritable bowel syndrome. Whether that's increasing your fiber intake for prebiotic effects or for motility, whether it's cutting out sugar to combat high bacterial counts. But what if all the food interventions are just not working? You follow a program, you cut things out, and yeah, you feel better temporarily, but it's almost like your body is adapting to your interventions and starting to complain again. Hint, that's exactly what it's doing. The immune system's whole job is adapting. In classic allergy, remove the food, remove the problem. In MCAS, anything you remove or anything that you're not consistently exposed to is, rightly or wrongly, identified as a threat. So removing things actually increases your sensitivity, not just to the thing that you've removed, but also everything else in general. So your diet will get narrower and narrower and narrower, and your capacity to get symptom relief through the diet will get smaller and smaller and smaller. So again, if all of your labs look good and your IBS symptoms persist or return in the long run, no matter how careful you are with your food, stop thinking food, start thinking MCAS. And lastly, number 3, the supplements don't work. Most gut supplements that are recommended for IBS are addressing some root cause. Antimicrobials for a bacterial overgrowth, for example. If you take these supplements, and again, you get temporary relief, but no permanent change, you might be paying attention to the wrong root cause. Sometimes the root cause is not bacteria. Sometimes it's not viruses. Sometimes it's not candida. Sometimes the root cause is the mast cells themselves.